Well, good morning, everyone. Hope you're having a good start to your day. And we want to say hello to some friends. And guys, good to have you on. And when you can come on live, we appreciate that, of course. And Brahim, you're numero uno this morning. Andrea, number 2. Let's see if Mike gets in the Trinity this morning. We're waiting. Number 3, Michael. You guys. Nativity. And John, how are you? And Eric, salut mon frère de Ottawa, Quebec. Madeleine, Kippawa, Quebec. And who's that in Niagara Falls? Rosalinda? Betty Lynn, how are you? Joanne, Fran, Orangeville. And Wendy, good morning. Markham. And Lori, Niagara Falls. Deb from Timmins. Cheryl, West Virginia. Marlo, Ottawa. And Nick from our staff. Linda, New Brunswick. Marilyn, Kelowna. And Maria. And Rita. And Lynn Marie, how are you? Krista, good morning. Vonda, PEI. And Heather Miramansi. And Lisa. And Kevin, there he is from Oshawa. Keith, good morning to you. And Lise, how are you? Lori and Adeline, good morning. And I see it goes up and I can't see it. Elaine Whitby. There was someone there from New Liskeard and I missed it. Linda, St. Jude, Quebec. Tina, good morning. And Chantal, how are you from Sudbury? Gail, Saskatchewan. Carol, Wasaga Beach. Linda, Uppsala. And Stouffville, who's that? Rita, from the French River. Beautiful. Nancy, Gore's Landing. Dave, good morning from Gilmore. And I lost it. Manitoulin, I'm going to say Georgie, but I could be wrong. Rita, Faith, PEI. Georgette, how are you? Donna from Bell Valley. And I think from Tennessee, could that be Doc McEwen? John, Elgin, Illinois. Jimmy, Florida. How's Florida doing this morning? They sure got a lot of rain there, depending on what part of Florida you're in and that tornado. And hey, guys, they're all going up in my cloud. I can't see them, I'm telling you. Okay. Let's get to our questions. And here we go. Numero uno here. And this is Kim. She's been following the EMC, smart girl, okay, since March and have done the reset. She's eating lots of eggs, meat, and cheese. Good for you. I used to be on low-dose thyroid medication, took myself off it in May, have been using the thyroid supplement for 3 months. My most recent TSH test showed a level of 8.41. What is confusing me is that my ferritin is also high. What I am looking for is how to supplement a thyroid and high ferritin. First of all, Kim, really important, okay? Not that I don't look at numbers. I want to know how you're feeling. So you send me an email at info@Martin Clinic. I want to know your symptoms, because if I look at your TSH, your TSH looks like you're out of whack, but you might not be. Now, high ferritin, it's not that high, but usually with high ferritin, and this could be affecting the thyroid, it's possible, because of conversion of T4 to T3. T3 is what your thyroid needs to function properly. Okay, everything gets broken down into T3. And that occurs in the liver mostly. Okay, so your liver has to be empty. Now, with high ferritin, there's two things that usually I see with ferritin when it's high. One, you have insulin resistance, and two, possibly fatty liver. And again, I don't know all of your situation. I'm just telling you what I usually see. So what I would say to you, Kim, if you're feeling good, I'm not too concerned. If I need to know your symptoms. So if you could give me a little bit more detail, I'll give you a better answer. Okay? And Sarah, what is whitish, yellowish spots around my eyes? What are they? Well, they could be cholesterol collecting around. I've seen it around the eyelids and that. Nothing to worry about. I've never, sometimes people get them surgically removed. I've seen that, but generally, I've never been too concerned about them, to tell you the truth. And anywho, that's what they could be. If you would send me pictures, I could give you a better answer. Again, send it. Like, sometimes I'm just guessing, guys. So if you want, send me a picture and send it to info@martinclinic.com. I'll give you the exact answer of what's around your eyes, Sarah. But that's what I'm thinking. Elaine, can you discuss supplements for hypothyroidism? Okay. And having stents in your heart. Well, they're two different things, right? So I don't know if this question is blended or you're just asking two separate things. Hypothyroid, well, I dealt with that, I'm going to say 1,000,000 times, but I'm exaggerating. But I mean, talk about, I saw that every day in my office. Hypothyroid. Now, it might not have been diagnosed. It's a sluggish thyroid. Okay? Now, some people actually had Hashimoto's. And it was, it was an autoimmune on the thyroid. But again, I would say supplements for hypothyroid, and hypo usually means slow metabolism, gaining weight, hair loss, eyebrows thinning, hair thinning, hips. Usually in the hips area for women, you get those saddlebags. That's often the thyroid slowing to a crawl, and could be constipation. A lot of things are symptoms of hypothyroidism. Okay, now having stents in the heart, well, or stents, so I would use, on the hypothyroid, let me answer them separately, EMC. The reason I talk about doing the reset is because it really helps with hormones. Now, let me get my little chart out. I do this all the time, but let me see where it is here. I usually have it right in front of me. Okay, if I don't, I don't. All right, let me just see. If I don't, I put it away, okay? But here's me, okay, guys, and I'm going to do it again just for your sake. I am going to draw this, okay? Here's what I did with my patients. And I flunked art. Okay? Got this? Now, guys, that's supposed to be a pyramid. Okay? And again, okay, I would tell people everything's connected. So you got your thyroid, in the middle you got your pancreas, and on the side you have your adrenals, and then you have ovaries, okay, in women. And then I sometimes draw a little circle in the middle down here. And okay, so let me show you this again, okay? Thyroid, in the middle, your pancreas, adrenals, the two of them, and then at the bottom you got your ovaries, estrogen and progesterone. All of these things are connected. And they're connected right in the middle here by that food, insulin. Okay, your pancreas, every time you eat. And when you lower your insulin, it affects the thyroid in a good way, your adrenals in a good way, and estrogen and progesterone, and even testosterone. It's so important to look at your hormones holistically. Everything is involved. Thyroid's involved. That's why the thyroid is so often misdiagnosed, because physicians have been trained. They weren't always trained like this. I can tell you that from history. But they're trained by the labs. They've been hijacked. I use that term, hijacked by the labs. What do I mean by that? Well, if you look at laboratory testing and you're only looking at laboratory testing, you can get, you can miss it. For example, Kim. I want to know what the lab says, yes, but I want symptoms. Because the lab can be deceiving. And when you look at all of the your hormones metabolically, they're all affected by food, all of it. So that's why I always start with food. Change fuels. Get better fuel. If you get better fuel, your endocrine system is going to work better. And then I supplement if needed. I'm often lowering estrogen. We live in an estrogen-dominated world. I work on that usually. If a woman, for example, is out of whack, or even a man, because men get more estrogen than their wives after the age of 50, and their testosterone sinks like the Titanic, that can be managed. That can be fixed. But you have to look at all of it. You have to look at the thyroid. You got to look at the adrenals. The adrenals have a big effect on the thyroid gland. The ovaries have a big effect on the thyroid gland. The thyroid is a puppet. It's got a lot of strings attached to it. And unfortunately, in medicine today, what they've done is isolated the thyroid. They've isolated it. And if the numbers are okay, doctors, oh, you're okay. The thyroid's okay. I mean, yeah, you got those symptoms, but it can't be your thyroid. Sure it can. But it's connected, and that's the key. I taught this for years. The endocrine system, understanding it. You got to figure it out, because if you don't, you're going to misdiagnose. Okay, so that's why, and then you're asking, wait a minute here. Elaine's saying, okay, supplements. So you might, for hypothyroidism, I would have you on the thyroid formula for sure. 2, I might have you on DIM for estrogen. I might have you on the menopausal formula to lower your estrogen. Flax seeds, lowering the estrogen, because that can really mess up your thyroid. And I might have you on cortisol control, depending on on your symptoms and what's happening with your adrenal glands, because that has an effect. What happens when cortisol is high? It robs your progesterone. And that can cause an imbalance between estrogen and progesterone. And now estrogen takes off. It's estrogen dominance. That affects the thyroid, slows the thyroid to a crawl. Anywho. Okay, and stents in your heart. Well, I'd have you on Navital. I'd have you on high DHA to lubricate your blood vessels. Navital opens up the blood vessels by elevating your nitric oxide. Plus, it's a powerful antioxidant that protects the endothelium level of the Teflon layer of your blood vessels, Elaine. Okay? So I'd have you on those two for sure. A lot of times, and a rule of thumb. If anything is wrong, take vitamin D. It's a rule of thumb. It's just so anti-inflammatory and so good for every area of your body, including your heart, blood vessels, whatever, vitamin D, B12. And eat right. EMC. Eggs, meat, and cheese. Okay. Angie, she did the reset. What a smart girl. Followed by low-carb diet. What a smart girl. And a few treats. Okay. Experienced tingling in the pinky finger. Okay. Could struggles with moles in the fall cause this sensation? I'm a hit and miss with Navital. Tingling in the pinky finger. I would think, okay, this is just me, Angie. And it's possible it could be something else. But generally, if it's just one pinky finger, usually you got a pinch in your nerve, and it's usually in your neck. Okay? That's usually what's going on. Mold, I would say off the top, no, but I guess it's always possible. But that wouldn't be what I'd be looking at, generally. Okay? And even an allergy to have tingling in the pinky finger. Now, tingling, just generally more tingling in your extremities. I'm looking, I have to rule out diabetic neuropathy or, any kind of neuropathy. But just strictly in the pinky finger, my clue would be to go to your spine, especially in the neck area, generally, okay? These are all good questions. Okay. Kim, I want to understand your K2. Okay. Many brands are 120 micrograms of K2 per 1,000 IUs of vitamin D. I'm assuming that's what you're talking about, Kim. I have abnormal calcium in the blood and want to ensure adequate driving of calcium into bones. Why do other brands have so much? Well, I'll tell you what I know. Two things, Kim. Okay? Two things. The quality of the K2, okay? The quality, the most absorbed. Ours is the highest absorbing K2 that you can get on the planet. So I don't know what the others are using. I know what I'm using, and it's the most absorbable. That calculation that we're using is the exact calculation that's recommended for every 1,000 IU of vitamin D. Okay? Now, you're not going to overdose on vitamin K2. Now, what do I tell you, Kim, to do with vitamin K2? Generally, I want you to eat it. Right? Eggs, meat, and cheese have vitamin K2. Now, you can take a vitamin K2 supplement if you're having calcium, like abnormal calcium means you got trouble with your parathyroid. If that's the case, you might want to take extra vitamin K2. I want you to eat it, but you can always take a supplement of vitamin K2. Not going to hurt you. And if you have a parathyroid problem, I probably might even have you on a separate supplement of vitamin K2. But there's two reasons that ours may be different. I don't know. I don't care so much about what other people are doing. I know that in my office, I had to get results. So our vitamin D, look, vitamin D, the best is in the sun. But when you're taking vitamin D as a supplement, I do recommend taking it with vitamin K2. And our K2 is the most absorbable form that you can get of K2. Okay? I hope I answered your question, Kim. Thank you. Paul, what supplements and diet is best for muscular dystrophy for my female friend? Well, I have them, on muscular dystrophy, one of the best things I found over the years was Navitol. Okay, Navitol. Now, look, there's no cure for muscular dystrophy. For a female, it's usually not Duchenne's. It could be, but it's usually not. Those are males. Generally, that get Duchenne's muscular dystrophy. I'm big on looking when what I would do when I would see it. Let me just Paul. When I would see Paul, any patient in my office, I did testing. I look for deficiencies generally, okay? And obviously, I'm a big food guy. So I would have them eat well. And the best is EMC, eggs, meat, and cheese. Of course, you can have some fruits and vegetables if you're not doing the reset. But just generally, those foods. Fuel. Usually what I found with MD, muscular dystrophy, low in B12, low in vitamin D, leaky gut, almost invariably when I saw it. They were low in omega-3, usually. And so I would address all of those deficiencies. And I usually put them on our blood boost, now called multi-nutrient. They did well with that. They felt better with that. No cure, okay? Anybody tells you they can cure muscular dystrophy, run, Forrest, run. Okay? They're lying to you. Okay. But generally, Paul, that's me. That's what I would be doing. CoQ10, they were low in CoQ10. I found, okay? I'd have them on ubiquinol. Okay. Eat lots of steak. Thanks, Paul, for the questions. Rita, are oral hyaluronic acid supplements beneficial to take for joint health, skin, and eyes for seniors? Yeah, I like hyaluronic acid. Your body makes hyaluronic acid, Rita. But what is a better oil than hyaluronic acid? I like hyaluronic acid. We have it in our Rivera. It's in our skin formula. Okay? But hyaluronic acid as a supplement, it's never really been proven to be effective. And I saw it a few times of patients that tried it in my office. I don't know. It wasn't dramatic or anything like that. I wouldn't be against anyone taking hyaluronic acid. I like for joints, I like vitamin D better with K2. I like our inflammation formula, if it ever comes back to Canada. Curcumin. I like it better. I like curcumin better than hyaluronic acid. I like Navital better than hyaluronic acid. I like hyaluronic acid. So I'm just telling you my clinical experience. These things were superior. Okay? Thank you for the question. And it's certainly not going to hurt your skin. I like eyes. Nothing better than high DHA for eyes. Nothing. Navital, high DHA eyes. Rita. Nothing better. It's not even close. I used to tell patients that. It's not even close. And I used to, if they would listen, I would talk to optometrists who were asking my patients and their patients, how come your eyes are improving? And they would tell them about Navital and high DHA that I would put them on. And sometimes they would call me and they wanted more information on that. I like that. They were open. I said, well, I'll tell you, if you look at the research on pine bark extract and eyes, diabetic retinopathy, glaucoma, and you name it, cataracts, unbelievable. Look at the research. Anywho, and I like the high DHA for eyes. Unreal, lubricate. Blood vessels. The eyes are all about circulation. Okay. Carol, I'm asking for a friend whose son is 14 and suffers from Crohn's. What is the source of the problem? Well, it's autoimmune. Crohn's is autoimmune. The body turned on itself. I am really big on doing all of the above, okay? I used to get very, very good results with Crohn's if they would follow the protocols. Not easy. Literally, a very limited diet, not too much roughage. Give them some berries, but not like I would have them on EMC. Sometimes they had to watch dairy, but they didn't have to watch cream. Got them off milk if it was just store-bought milk. But generally, not a lot of fiber. That irritates Crohn's. I'd fix the leaky gut, and it would take time. Probiotics, oil of oregano, and usually they were full of fungus, candida. Work on that, all of it. Leaky gut, anti-inflammatory diet, probiotics, bone broth. I'd have them on gutties, our IBS formula, all of those things I would be doing. Okay. Crohn's. Carol, thank you. Claudia, what do you recommend for high uric acid? Well, high uric acid, okay, causing gout, because you can have high uric acid and it's not causing gout. But you take this is why I've talked to you in the past about using uric acid as a biomarker for metabolic syndrome. Why? Because gout or high uric acid is an insulin problem. It's not a purine problem. It's an insulin problem. It's not a meat problem. Well, it is a meat problem. You're not eating enough meat. If you Google it, it'll tell you you're eating too much meat. But it's not that. We called it the king's disease, and the king was drinking too much wine, fructose. And gout is up about 300% since the 1980s. What happened in the 1980s? High fructose corn syrup. So now we have fatty liver. We have high insulinemia. or high circulating insulin, or insulin resistance, and it's inflammatory. Uric acid levels go up almost invariably, and some people get gout. It ain't no fun, but as far as diet, you lower the carbohydrates. You lower no high fructose corn syrup. None. Zero. Nada. Cut out all the sugars because they're mostly use fructose. And fructose goes directly to the liver. That's why we have so much trouble today with so much gout and happening at a much younger age than it used to. And it ain't no fun under the sun. Okay? So that, and you know one of the best things you can do for gout? Drink coffee. That's been proven, by the way. Drink coffee. It is very, very good for high levels of uric acid to lower it. And I would use curcumin. I use anti-inflammatory. I loved all of the above. Okay? Thank you. That was Claudia. Liette. Suffering from frozen shoulder. No fun, huh? Okay? No fun. Now, there's two things I want you to do. Okay? One, get a yardstick, or a golf club, or a broom handle, and I want you to do this exercise. Lie in bed and put your arms over your head with that light weight. Use your bad arm too. And with your good arm, you're bringing your arms over your head, down to your waist, up over your head in bed. Do that 3 or 4 times a day. It's a tremendous exercise. I used to get patients, if they could, even install a pulley in their house, and they would do an exercise with ropes over their head and using your good arm to pull on the bad arm. You got to get it moving. It's hard. Frozen shoulder. The body is just because there's usually a calcium deposit in there. It wants to freeze up and say, stop. Hey, dummy, quit using your arm. It hurts. Okay? That's what the body does. But you can't do that because you get a frozen shoulder. And yeah, I know cortisone and all this and that, they do it. I like that exercise, and I'll tell you a trick that we use. I called it the hammer. Okay? High levels of, you can use curcumin if you want. Okay? Until our inflammation. But some people swore by this. Using about 12 to 14 capsules. Curcumin, or our inflammation formula, if it ever, anyway. Don't get me going. I have to keep my blood pressure down. Some people found dramatic results after 3 days of doing the hammer. Hammering it. They're very, very anti-inflammatory. Didn't work every time, but it worked a lot of the times. And I would have them using high levels of vitamin D. Even vitamin D is such an anti-inflammatory. People don't know that. But even 50,000 units of vitamin D for 3 days. Unreal. That was what I would try. Okay? Good question. And do that exercise. Really important to do. We called it a passive exercise. You're letting your good arm work the bad arm. Okay? Thank you very much for the question, Liette. Let's see. You know what? I might be able to get to these here. Sharon, I got a peptic ulcer. What to do? Well, let me talk about a peptic ulcer. because there's 4 or 5 things that'll cause it. Okay? H. pylori can cause a peptic ulcer. That's a bacteria. And almost everybody has H. pylori, but if it gets activated, it can burn a hole in your small intestine. That's a peptic ulcer. In your duodenum. Okay, you can get a gastric ulcer, and that can be, a gastric ulcer can also be H. pylori. The other one is non-steroidal anti-inflammatories, over-the-counter Advil and Aleve and those type of things can cause a peptic ulcer. Alcohol, peptic ulcer. Bad eating, just terrible eating. Fast foods, refined food, they're no void of any B12, of any vitamins, and that can affect and cause a peptic ulcer. Stress can cause a peptic ulcer. I've seen it. Stress. The fight or flight that never goes away. And, under a lot of, and that can cause a peptic ulcer. Okay? And what do? I'm big on mucilages. Okay? I like chlorophyll. But I used to use, and I still do recommend, our IBS formula because it's got mucilages in it. It coats the stomach and the bowel. Okay? IBS, probiotics, absolutely essential to kill the H. pylori. I would use digestive enzymes. Not hyaluronic acid. Don't use acid, whatever you do. Like a bile acid, don't do that. Not with a peptic ulcer. But digestive enzymes are good because they break all your food down in your stomach before. And I like fasting. I'm not eating at night at all. Okay. Yeah, maybe I'm not going to get to all. Let me see here. Where are we at? Okay. Does sugar-free syrup cause the gut to be unbalanced? Well, look, anytime you see an artificial sugar, okay? That's, for years, people drink Diet Coke or this, it's unsweetened. It's sweetened with what? And any artificial sugar, now we know this, we didn't know it 30 years ago, but we know it today, it does disrupt the microbiome. So I tell people to be very, very careful with that stuff. Whether it's in a syrup or a soda or whatever, not big on it because of the disruption of the microbiome. Okay? And even with that, you're still low. You don't, your glucose is not elevated, but your insulin is. So it can still cause, even these artificial sugars can cause insulin resistance. Kind of surprising, but it can. The research is pretty clear on it. Margie, I'm having terrible time with body temperature, usually really hot when I shouldn't be, then sometimes cold. Is this hormonal? You bet your boots. Margie, you bet your boots it's hormonal. You're out of whack. Go back to that pyramid that I showed you earlier. You're out of whack for sure. And your thyroid is playing tricks on you. And, you're, I don't know how old you are, but perimenopausal, menopausal, hormones. Men, we don't get that. How do you like that? We're from another planet. Okay, Jan, last question. We're going to get through it today. I take the citrate, magnesium citrate for 4 years. Love it. Keeps me regular. But after your newsletter, I have most symptoms of low magnesium. Maybe it's not absorbed properly. Well, it's doing something because it's keeping your bowel regular, magnesium citrate. You know what, Jan? Do what I do. I take both. Okay? I take both. Some people love the citrate. They never have any digestive issues at all. I like the two of them, but you seem to be doing well. But if you're getting those symptoms, I would tell you to do both. Because you don't want to come off the citrate if it's helping your bowel. Try it. A lot of people do. Okay. I don't know, like you say, it's not absorbed properly. No, it's just, you may not be taking enough of it. I don't know. Okay. Guys, we got through all the questions this morning, I think. Yeah, I think so. Okay. Wasn't that fun? Okay. Guys, we love you dearly, and we thank you for asking all those questions. We appreciate it. We love Question and Answer Friday. And don't be shy. You can share this, okay? We love you dearly. We'll talk to you soon.